There is a letter sitting in a government processing center right now with your name on it. If you are between 55 and 64 years old and you receive food stamps, that letter is coming. It may already be in your mailbox. It may arrive next week. But when it does, it will inform you that the rule protecting people your age from SNAP work requirements no longer exists. It will tell you that you now have 90 days to prove you are working, volunteering, or in a training program for at least 80 hours every month. And if you do what most people your age are doing right now, which is assuming the letter is a mistake, tossing it aside, and waiting for someone to correct the error, you will lose your food assistance for 33 consecutive months. Not 33 days. 33 months, almost 3 full years without a single dollar of grocery help. At current benefit levels, that translates to over $6,000 in food assistance that will never reach your kitchen table. Over $6,000 worth of eggs, bread, vegetables, chicken, and basic nutrition erased from your life because you did not respond to a letter within 90 days. This is not hypothetical. This is active federal law being enforced in every state in America right now. The Congressional Budget Office estimates nearly 4 million people per month will lose benefits under these changes. If you are between 55 and 64 and you rely on SNAP to help feed yourself, the next few minutes of information could be the difference between keeping your benefits for the next 3 years or losing them entirely because of one assumption you made about a rule that no longer exists. Let me explain exactly what changed and when. On July 4th of 2025, President Trump signed the One Big Beautiful Bill Act into federal law. This sweeping legislation restructured multiple programs serving Americans, and one of its most significant provisions targeted the Supplemental Nutrition Assistance Program. SNAP is the largest anti-hunger program in the United States, serving over 42 million people, including more than 11 million adults aged 50 and older, according to AARP data. The average benefit for older adults works out to approximately $188 per month, roughly $6.20 per day. Before this law, SNAP operated with a classification called ABAWD, Able-bodied Adult Without Dependents. The ABAWD rules imposed strict work requirements and a time limit, but they applied only to adults between 18 and 54. If you were 55 or older, you were categorically exempt from these requirements. You could receive SNAP indefinitely without proving you worked any specific number of hours. That protection was considered settled policy for decades. Millions of older Americans relied on it without ever questioning whether it might disappear. Under the One Big Beautiful Bill Act, the ABAWD age ceiling was raised from 54 to 64. For the first time since the SNAP program began in the 1960s, adults between 55 and 64 are now subject to mandatory work requirements and the 3-month time limit. The expanded rules took effect November 1st of 2025, and all 50 states are now enforcing them. This is confirmed by the USDA Food and Nutrition Service at fns.usda.gov/snap/work-requirements, by AARP at aarp.org/advocacy/snap-work-requirements-what-to-know, and by the National Conference of State Legislatures. This is current law, not a proposal under consideration. Here is what the law now demands of you. If you are between 18 and 64 and classified as an ABAWD, you must perform at least 80 hours per month of qualifying activity. That averages 20 hours per week, though. Weekly totals can fluctuate as long as your monthly total reaches 80. Qualifying activities include paid employment at any wage level, whether full-time, part-time, or gig work. Unpaid volunteer work at any recognized nonprofit organization qualifies, including churches, food banks, libraries, community centers, hospitals, animal shelters, thrift stores, and any other charitable organization. Participation in a state-approved job training program qualifies. Enrollment in educational courses qualifies, including GED programs, ESL classes, vocational training, community college courses, and workforce development workshops. Participation in a workfare program assigned by your state qualifies. Any combination of these activities totaling 80 hours per month satisfies the requirement. There is also an earnings-based alternative. If you earn at least $217.50 per week, equivalent to the federal minimum wage of $7.25 multiplied by 30 hours, you are considered compliant regardless of specifically documented hourly totals. The absolute non-negotiable requirement across every pathway is verifiable documentation. Your word is not sufficient. You need pay stubs with dates and hours clearly shown. You need a signed letter from your volunteer supervisor including their full name, organization name, phone number, and confirmation of your hours. You need training enrollment verification and attendance records. Without this documentation submitted to your benefits office, the system treats you as non-compliant even if you actually perform the work. Undocumented compliance is identical to non-compliance in the eyes of the program. This single administrative reality is causing thousands of people who are actually meeting the requirement to lose their benefits because they failed to create the paper trail. The consequence of non-compliance is devastating and immediate. If you fail to meet the 80-hour threshold and do not hold a qualifying exemption, federal law limits you to 3 months of SNAP benefits within any 36-month period. 3 months is your total allowance. After those 3 months expire without documented compliance, your benefits terminate automatically through the system. You cannot receive SNAP again for the remaining 33 months of that 3-year cycle unless you meet the work requirement for a full consecutive 30-day period and successfully reapply, or unless you become exempt through a qualifying category with proper documentation on file. 33 months without food assistance. At $188 per month, that is $6,204 in benefits that never reach you. That is 3 years of supplemental nutrition gone because of 3 months without the right paperwork. You might assume your state can waive this requirement in areas where employment is difficult to find. Under previous law, states had broad discretion to waive ABAWD time limits for geographic regions with high unemployment or limited job availability. That flexibility was the primary mechanism preventing the harshest outcomes for decades. It is now essentially gone. Under the new law, states may only waive the time limit if local unemployment exceeds 10%. The Brookings Institution found that this threshold was reached nationally during only one single month of the entire Great Recession. In practical terms, waivers are functionally unavailable across the vast majority of American counties, regardless of local hiring conditions for older workers. The state-level safety valve that protected vulnerable populations for decades has been legislatively sealed shut. Several exemptions that previously shielded specific groups were deliberately eliminated by this law. Veterans no longer hold automatic exemption from SNAP work requirements. If you served in the United States military and received SNAP, you must now meet the 80-hour monthly requirement or qualify through a separate category, such as documented disability. The automatic exemption for people experiencing homelessness was removed entirely. The caregiver exemption was narrowed. Previously, caring for any child under 18 in your SNAP household exempted you. Under the new law, the child must be under 14. If you are raising a 15, 16, or 17-year-old grandchild, that caregiving no longer provides exemption. Youth formerly in foster care who previously held automatic protection are now also fully subject to ABAWD requirements upon turning 18. Exemptions that remain available include the following circumstances. Adults 65 and older are exempt. Adults under 18 are exempt. Recipients of supplemental security income, Social Security disability insurance, or veterans' disability compensation at any level are exempt. Pregnant individuals are exempt. People caring for a child under 14 in their SNAP household or an incapacitated household member requiring their care are exempt. People certified by a physician, licensed mental health professional, or caseworker as physically or mentally unable to sustain 80 hours per month of work activity are exempt. People actively participating in substance abuse treatment programs are exempt. And under a new provision specific to this law, Native Americans, Alaska Natives, Indigenous peoples, and enrolled tribal members are exempt from the ABAWD time limit. The critical point that cannot be overstated is that every single one of these exemptions requires formal documentation submitted to your local benefits office. None activate automatically. None are assumed by the system. Without proof on file, you are processed as a standard non-exempt ABAWD, regardless of your actual qualifying circumstances. People with severe arthritis, chronic pain conditions, documented mental health disorders, and obvious physical limitations are losing benefits every day because they assumed their condition spoke for itself. It does not. The system requires a piece of paper. Without that paper, you are non-compliant. Let me describe what is happening right now across the country to illustrate why immediate action matters. A 62-year-old man who worked in a warehouse for 28 years until his company downsized receives $142 monthly in SNAP. He has arthritis in both shoulders and chronic lower back pain. When the new requirement letter arrived, he assumed it was sent in error because he remembered that people his age were always exempt. He did not respond. He did not call his caseworker. He did not see his doctor. 3 months later, his EBT card was declined at the grocery store checkout. He called the office and learned his case was closed for ABAWD non-compliance. He cannot receive benefits for 33 months. His arthritis almost certainly qualified him for a medical exemption. One doctor visit producing one letter would have preserved his benefits uninterrupted. He could have volunteered at a local food bank sorting donations at his own pace. He could have cited his transportation barriers under the good cause provision. Multiple pathways existed to protect him. He used none because he relied on an assumption that was no longer legally valid. 5 misconceptions are actively causing mass benefit loss among older adults right now. First, the belief that people over 55 remain exempt. They are not since November 2025. Second, the belief that health problems create automatic exemption. They do not without formal documentation on file. Nearly half of SNAP participants between 50 and 59 have qualifying disabilities, but many have not completed the documentation process because it is poorly explained and administratively burdensome. Third, the belief that military service provides continued protection. The veteran exemption was legislatively removed. Fourth, the belief that states will waive requirements when jobs are unavailable, nearly impossible under the 10% unemployment threshold. Fifth, the belief that this affects few people. CBO projects 4 million people monthly losing benefits. AARP research confirms 1 in 6 older job seekers experiences age discrimination as a direct hiring barrier. Older displaced workers take measurably longer to find reemployment than younger workers in identical labor markets. And approximately 60% of older adults who qualify for SNAP are not even enrolled due to stigma, application complexity, and lack of awareness about both the program and its rules. Your legal protections are significant when you actually use them. Federal regulations at 7 CFR 273.15 guarantee every SNAP recipient the right to a fair hearing within 90 days of receiving an adverse action notice. If you request that hearing before the effective date of your termination, typically within 10 to 15 days of receiving the notice depending on state procedures, your benefits must continue at the current level while the hearing proceeds. The state must conduct the hearing and issue a decision within 45 days. You do not need formal disability status to qualify for medical exemption. A physician's letter, a caseworker assessment, or documentation from any licensed healthcare provider describing your functional limitations can establish your inability to sustain 80 monthly hours of work activity. The good cause provision shields you from penalties when non-compliance results from circumstances beyond your control, including vehicle breakdowns, medical emergencies, family crises, or severe weather-preventing travel. Volunteering counts identically to paid employment. Any documented hours at any nonprofit organization fully satisfy the mandate. Training programs, educational enrollment, GED preparation, ESL courses, and workforce readiness workshops all count toward the 80-hour requirement. Your immediate action plan requires 3 steps executed this week, not next month. First, call your local SNAP office today using the directory at fns.usda.gov/snap/state-directory. Ask whether you are currently classified as an ABAWD. Ask your specific compliance deadline. Ask what documentation format your state requires for exemption claims. Verify that your current mailing address and phone number are accurate in their system because a single notice sent to a previous address can trigger automatic termination without your knowledge or opportunity to respond. Second, if any physical or mental health condition limits your capacity for sustained work activity, schedule a medical appointment this week. Get a written statement from your doctor specifically indicating that you are unable to meet a requirement of 80 hours per month of work activity due to your medical condition. Include the specific conditions, their functional impact, and your doctor's professional opinion on duration. If you receive SSI, SSDI, or VA disability, gather your current benefit verification letters. If you care for a child under 14 or an incapacitated family member, document that caregiving role formally. Submit everything proactively to your caseworker before your next recertification date. Do not wait for them to request it. Third, if you are able to work or volunteer, begin immediately and document every single hour from day one. Maintain a dated written log including times, locations, activities performed, and supervisor contact information. Obtain written confirmation letters from coordinators. Preserve all pay stubs and enrollment records. Submit documentation copies to your caseworker at each required reporting interval. If your benefits are terminated and you believe the action was taken in error, file for a fair hearing the same day you receive the notice. Filing within the initial 10 to 15-day window is what triggers mandatory benefit continuation during the appeal. After that window closes, you retain appeal rights for 90 days, but benefits will not continue while the case is reviewed. 1 day of delay can be the difference between maintaining food assistance during your hearing and going without. The broader landscape makes urgent action even more critical. By January 2027, Medicaid work requirements of 80 hours monthly take effect for non-disabled adults 18 through 64 under this same law. Millions between 50 and 64 could lose health care coverage under parallel requirements. Starting fiscal year 2027, states assume 75% of SNAP administrative costs, up from 50% straining agency capacity and caseworker availability. By fiscal year 2028, states with payment error rates above 6% must pay 5 to 15% of benefit costs themselves, creating institutional pressure that may increase processing speed at the expense of accuracy. SNAP nutrition education funding ended October 2025. Future benefit increases are permanently capped to inflation only. The support infrastructure is contracting from every direction simultaneously. SNAP lifted nearly 2 million adults over 50 out of poverty in 2022. In 2024, 13.7% of American households experienced food insecurity according to USDA data. Food insecurity in older adults directly correlates with increased hospitalizations, worsened chronic disease management, higher rates of depression, medication non-adherence, and accelerated cognitive decline. Losing SNAP access is not an inconvenience. It is a measurable threat to your physical health, mental health, independence, and long-term survival. One phone call this week protects your benefits for 3 years. One missed deadline costs you benefits for 3 years. The math is that simple and that permanent. Do not assume the old rules protect you. Do not assume a letter is an error. Do not assume your health condition exempts you without documentation. Act this week. Share this video with every person you know between 55 and 64 who relies on food assistance. They need to hear this before their 90-day window expires. Subscribe to this channel and activate all notifications, because the follow-up covers the complete state-by-state exemption documentation guide, the exact fair hearing filing process with forms and deadlines, and the 2027 Medicaid work requirements that will compound this situation for millions more Americans. Save this video and return to it before your next recertification date. This is USA Benefit Advisor. Stay protected, stay informed, and never lose a single benefit because of a rule change you were not told about.